Hello, I'm Dr. Robin Crouch. I am a chiropractor and brain core neurofeedback specialist in Port Washington, New York, and you're in the right place if you're looking to manage the symptoms of ADHD for yourself or a child. I'm hoping to give you some great information today that you could start implementing right away. If you have any questions, please give us an email at drrobincrouch@gmail.com, or you can go to braincoretherapy.com to see if there is a practitioner near you. Practically everyone in America at this point has heard of ADHD, and it's often the topic of conversation amongst parents and caregivers, at dinner parties, on the soccer field, but most people don't really know what ADHD is. They simply think it's the inability to pay attention or hyperactivity, but as most of us know, there's a lot more to it than that. And in fact, in 2011, the CDC reported that 11% of all children in the United States have been diagnosed with ADHD. And that's just the ones that have been diagnosed. And 6% of all those children are on some sort of medication for ADHD. There's no single test for ADHD. A doctor can diagnose ADHD with the help of standard guidelines. So the diagnosis of ADHD involves gathering the information from several sources, whether it be teachers, caregivers, parents, grandparents, and then the doctor considers how a child's behavior compares with that of other children the same age. So attention deficit hyperactivity disorder is diagnosed after a child has shown 6 or more specific symptoms of inactivity and or hyperactivity on a regular basis for more than 6 months and in more than one setting, so meaning home or school. And as many of us know, children with ADHD struggle in school, whether it's their inability to focus or their hyperactive and impulsive behavior, constantly getting in trouble. And this creates problems developing relationships and ultimately affects their self-esteem. They're often made to feel unintelligent or dumb. ADHD is not a sign of intelligence or bad parenting for that matter. Children with ADHD have a higher probability of chronic lateness and forgetfulness, anxiety, and as they get older, employment issues, difficulty controlling anger because they're getting so frustrated. They continue to be impulsive. They can develop aggressive, violent, and antisocial behaviors, and they're more likely to use drugs and alcohol. And then they tend to have less job success, more auto accidents, rockier relationships, and more trouble with the legal system. The term ADD has been replaced with ADHD, and it involves a cluster of symptoms, but mainly divided into 3 categories. If you look at Dr. Amen's information, he divides things into further categories. So we have the combined type, which is inattentive, hyperactive, and impulsive. And children with these types of ADHD show all 3 symptoms, and that's the most common form of ADHD. Then there's the hyperactive impulsive type, and these children show both hyperactive and impulsive behaviors, but are actually able to pay attention. How that is, I'm not really sure. And then there's the inattentive type, formerly known as ADD. And these children are not overly active, so they don't have that hyperactivity component. They don't disrupt the classroom or other activities, so their symptoms might not get noticed. Because of their inability to pay attention, they kind of slide through the cracks because they're not creating a ruckus or constantly getting in trouble like some of the other kids with the hyperactivity and impulsive behaviors. The majority of scientific research tells us that the central feature of ADHD is poor regulation of the brain's arousal state. So that means how sleepy or how awake the brain is. So our brains have an optimal zone of performance, and we have low arousal or slower processing for things like getting ready for bed, relaxation. And then we have a higher arousal or faster processing for things like learning new material, giving a presentation, sports activities. And depending on the circumstances and everyday demands, the brain may move more towards one of these phases of arousal, but it should have an optimal zone of performance. A way to understand this is think of the intensity of a light in a room. So you can have a dimmer switch that controls the light levels, and we can have every level of light from complete darkness to so bright that you have to cover your eyes, right? So the dimmer switch of arousal in the brain is located in a part called the thalamus. And like the dimmer switch that adjusts the light levels, the thalamus automatically adjusts the intensity of arousal for the task at hand. So like I said, for a restful sleep, the intensity is turned down all the way down. For reading more difficult material, the intensity goes all the way up. And most activities fall between sleep and intense thinking. So in many neurological disorders, the light, or the arousal level, stays adjusted to one intensity. In the case of ADHD, it's on dim. Okay, so now you're thinking, how is it possible that somebody is hyperactive? How can it be that they have low arousal levels? I'll give you an example. We've all driven long distances, right? And it could be at night or even during the daytime, and we get sleepy. So what do? We turn up the radio, we roll down the windows, we could turn the air conditioning on, we tap along to the music, we sing along to the music. To do what? To make ourselves hyperactive. Well, the same thing happens with somebody with ADHD. They're stimulating their brain to wake up. So each of these mental states are associated with specific brainwave patterns. So we have neurons that fire in our brain and they produce a lot of electrical activity. And you can read that electrical activity using an EEG, which we'll talk about a little bit more in a little bit. And what shows up on the screen are brainwaves, and these brainwaves are associated with specific mental states. So there are brainwaves that include delta, theta, alpha, and beta. So just to get a glimpse of what it might be like for someone with ADHD is to imagine someone walking into your room in the middle of the night. You're in a deep, deep sleep, and all of a sudden they wake you up and they ask you to balance your checkbook. Obviously, you have the intellectual ability to do that, but you have the wrong arousal level. You're half asleep. That's what it can be like for somebody with ADHD. The medical approach in the treatment of ADHD is generally multifaceted. As you may know, it consists of medications or behavioral modification, therapy, or all of the above. Making the decision to put yourself or your child on medication is definitely a difficult one, and I'm not saying that it's a wrong thing to do, but I do think that it's important to understand what the medication can and cannot do. The medication may improve focus and concentration and decrease hyperactivity, but it may not solve all of your child's problems. A class of drugs called psychostimulants or stimulants have been used effectively to treat ADHD for years. What they do is they work by activating the brain, so it's turning that light up artificially. It's important to understand that this is temporary and that it increases the brain's arousal. Your child can sit and pay attention, or you can sit and pay attention. Stimulants on the street have a similar effect on the brain as amphetamines and cocaine, and they're considered a Schedule II drug along with amphetamines, morphine, barbiturates, and anabolic steroids. So medication in this category are most strictly controlled as they are deemed to have a very high potential for abuse or dependency. Then there are non-stimulant medications such as Strattera that works by increasing chemicals in the brain, norepinephrine in particular. That also increases nerve impulses, so it can also turn up the light or increase the brain arousal levels. Antidepressants are often used as well for ADHD because they increase the message signaling of the brain. And then there are blood pressure medications such as Capve and Intuniv are also used for symptoms of ADHD. And how they work is still unknown, but they know that it changes the nerve impulses. Sometimes the medication can have some unwanted side effects, such as decreased appetite or weight loss, sleep problems, headaches, jitteriness, social withdrawal, stomach aches, or tics. And sometimes, but rarely, the medication can cause more serious side effects. For instance, stimulants are associated with an increased risk of severe cardiovascular problems. So my suggestion is that if you are going to put your child on stimulant medication, that they do have a full cardiovascular workup. These medications may also exacerbate psychiatric conditions like anxiety or depression. And stimulants can trigger or exacerbate symptoms of hostility, aggression, anxiety, depression, like I said, and paranoia. And people with a personal or family history of suicide, depression, or bipolar disorders are at a particularly high risk and should be carefully monitored when taking stimulant medications. growing problem in our country is teenagers and I guess college students are in their 20s, so they are sharing their ADHD medication, particularly Adderall. Kids are buying it from people to study for longer periods of time, and this can really pose a great risk, especially if this medication is not something that you need. It's like taking speed. It is speed, actually. So really making sure that your kids understand the risks that they are causing to themselves and to others by sharing their medication. If your kids are home, and they're teenagers, I suggest counting their pills regularly just to make sure that they are not sharing the medication. We know scientifically that the medication doesn't fix the problem. It speeds up the brainwave activity, but it's only a temporary treatment. So you remove the stimulant and the brain slows down again. And not only does it not fix the problem, it has side effects like I mentioned, and we really don't know what the long-term consequences are. So what are some of the things that we can do to turn up the dimmer switch on the brain? So each of one of these things that I'm going to talk about could obviously be a webinar in itself. So in the future, I will be breaking each of these down into separate webinars. So if you have any interest, definitely contact us. Food is actually fuel for the brain and the body. If you could remove the chemicals from your child's and your food, you'd be giving them a much greater chance to thrive. Processed and packaged foods come with tons of chemicals. Try simply sticking to whole foods. I know it's difficult. I know you have a lot of picky eaters, but something that you really have to work at. So I know that knowing that it's difficult, if you get 80–90% of good clean food into your family, everybody's success is much greater. That saying that you are what you eat, it's really true. So people always ask me, well, what should I look for in food labels? The truth of the matter is we really shouldn't be eating too many foods with labels. We should be eating whole foods. I know we all live busy lives and it's hard to cook, but if you take the time to prepare, get some great recipes. If you want to email me, I can give you some great places to look for those great recipes. You can really create some really nutritious and great tasting food that your kids are going to love. It may take a while to get them to start to eat that stuff, but I really think it's important that we nourish our children and ourselves. Our brains use food as its fuel. So if you're giving it red dye number 1, red dye number 20, your brain is operating from those chemicals, not from good nutritious food. Along with the toxins and chemicals in our food, we have toxins in our cleaning supplies, stuff we put on our skin. I know we can't control the toxins in our environment, but we can control what's in our home. So getting away from using toxic chemicals as cleaning supplies, that good clean smell that you're smelling from those cleaning supplies is actually toxins. There are so many great alternatives out there. Vinegar is a great cleaner. I know it doesn't smell so great, but it's definitely an option. I use a lot of essential oils, and if you want some more information about that and about cleaning with more natural cleaning products and how to make your own stuff or which brands are the best, you can contact me as well. And it also goes for all the stuff that we put on our skin. Our skin is the biggest organ. It absorbs everything. It goes into the bloodstream. You're putting chemicals on your skin, get into the bloodstream, goes up to the brain. Your brain is then again operating from a non-clean place. So the shampoos, lotions, potions, all that stuff. Movement is imperative for ourselves and for children. So the part of the brain that we stimulate when we exercise is the back of the brain called the cerebellum. And the cerebellum actually then drives to the frontal lobe. And the frontal lobe of the brain is where that executive functioning comes in. So we strengthen that cerebellum, we strengthen the frontal lobe, and our brains start to work much better. So getting our kids away from the TV and the computer, the video games, it's really important to get them moving. So like I said, the TV and the video games is really not great. We recommend people have their children watch no more than an hour, hour and a half a day. When you think about that, that's a long period of time. We have people that come to us, their kids are watching 2 or 3 hours of TV a day. What happens with the child who watches a lot of TV, it actually slows down their brain waves even more. So that's why they become in that hypnotic state where you say, oh, my kid can't pay attention in school, but for some reason he can pay attention to what he wants to. Yes, because if he's watching the TV or the video games, it's dimming that switch even more and putting them into a hypnotic state. So what we do in our office is something called brain-core neurofeedback. And in 2013, the American Academy of Pediatrics approved neurofeedback as a level best one support for the treatment for ADHD. So what is neurofeedback used for? Neurofeedback is based on over 40 years of peer-reviewed research. It can help with any neurological or emotional issue, things like ADD, insomnia, anxiety, depression, PTSD. It helps with children on the spectrum, as well as many other neurological and emotional conditions. So neurofeedback is a training procedure designed to bring balance, harmony, and regulation to the brain. It's painless, drugless, and non-invasive. So again, a healthy regulated brain is able to shift easily between arousal states as the demand arises. And we have mental states that are associated with those particular brainwaves. A dysregulated brain has a tendency to habitually operate from one of the three arousal states, so that dimmer switch is stuck. And oftentimes with the case of ADHD, we're talking about an under-aroused brain, somebody who's stuck in slower processing. And the symptoms that may be associated with that are impulsivity, being socially inappropriate, hyperactivity, easily distracted, excessive speech, disorganized, hyper-emotional, as well as many others. An individual's habitual arousal state might be too high or too low. So somebody who has excessive delta and theta, which is that under-aroused stage, these patients usually have some kind of cognitive impairment, focus, attention issues, ADHD, be somebody with a traumatic brain injury, dementia, or learning disorders. And then somebody who's stuck in the middle would have some particularly elevated alpha, and they usually have depression, irritability, could be metabolic issues. And somebody with elevated beta, generally things like anxiety, panic attacks, OCD, migraines, tension headaches. And obviously a brain can have more than one area where they have dysregulation. So part of the brain can be going too fast and some part of the brain can be going too slow as well. So how do these things happen? Well, brainwave imbalance or neurological dysregulation could be caused by variations in brain structure, drugs, toxins, poor nutrition, nervous system imbalance, trauma, and stress, both physical or emotional. So what is brain-core neurofeedback? Brain-core neurofeedback begins with a QEEG evaluation. It's an electroencephalogram. So remember before I mentioned how our brain works by neurons firing, and these neurons create a lot of electrical activity, and we can read that electrical activity through an EEG. We use the QEEG, which reads 12 different areas of the brain at once. So it's an assessment tool designed to objectively and scientifically evaluate a person's arousal levels and brainwave patterns. So the 12 areas of electrical activity from the brain are recorded, and then they're compared to a normative database, meaning people who have reported no symptoms, and then a brain map is generated. And it's important to understand that no information is going in the brain. The sensors from the QEEG cap are simply reading the brainwave patterns. And then this map is generated. And the map will show us different areas that the brain has some dysregulation. So in this case, it's the frontal lobe, the temporal lobe, and the occipital lobe. So it's showing us where the areas of dysregulation are and what particular area of the brain the person is stuck in, so where the dimmer switch is stuck. And in this case, it happens to be mostly alpha, so that's that idle state of the brain. And this column is what the parents or the patient have filled out based on their symptoms, and then this column shows what the EEG shows as a probability that person may be experiencing those symptoms. And then the information we get from the map also gives us information on how the procedure is going to be executed. So it gives us a protocol based on that map. And once we figure out what part of the brain we're going to work on from the map, patients are hooked up to the computer with wires and sensors, and the computer reads their brain waves. And it's important to, again, understand that the sensors do not put any electrical current into the brain. They simply act as antenna to capture the electrical currents coming from the brain. So it's reading the brainwave patterns. So information about these brainwaves is displayed on the doctor's monitor. And here we see a still image of the doctor's monitor identifying the parameters of certain brainwaves being produced by a patient in real time. And the feedback appears in the form of a game, a movie, or a sound. And while the patient is lying there relaxing, watching a movie, for example, the minute that they shift their brain from a slower processing to a faster processing, so turning up the light, their brain gets rewarded with the movie playing brightly. And the minute their brain begins moving into a slower processing, that dimmer switch turns back down, the movie goes dark. So the brain learns through operant conditioning, remember the rat learning to press the lever for food. So the brain learns to keep the screen bright. And this in turn trains the brain to create new connections, and through what's called neuroplasticity, trains the brain to become more balanced. When you have information on what your brainwaves are doing, you can actually use that information to change how it's working. And once we learn something, it becomes part of our behavior. And follow-up studies in neurofeedback show that the effects continue for up to 30 years. How long does it take to get results? Trainees typically come for 30 to 40 sessions of training. Depending on the severity of the case, some people need more. Trainees come a minimum of twice a week. Some people do come more. And each session is about 30 minutes long. And typically we begin to see changes in about 8 sessions. That could vary. It could be less, it could be more, all depending on the situation. So like I said before, neurofeedback is based in over 40 years of clinical research proving its efficacy. There's some great books out there that you could also read. One that I really like is called Symphony in the Brain. And then there is another one called Healing Young Minds. It gives you some information about the history and a little more in depth on how it works. So I'm going to ask that if you do have questions that you give me an email at drrobincrouch@gmail.com, and I'll be happy to answer your questions. I'm going to flip me back here. I'm back. So I want to thank you for taking the time to watch this presentation. I want to offer you a QEEG evaluation at a discounted price, and just note that this is for the Port Washington office only. We're offering $75 off your initial evaluation for you or a child, so there's no limit to how many evaluations you can get with that special price. So if you want to set up an appointment to see what's going on in your brain or your child's brain, so give us a call at 516-944-4469. Again, thank you for taking the time to watch this presentation. I look forward to helping you in the future.